And of course, we do some porcelain work, onlays, and porcelain veneers, but my main passion is composite. I work with the old generation composite, with the new generation composites. And in this lecture, I'm going to show you a clinical approach. It's not going to be a very scientific lecture. It will be more about the clinical and how do I do. And now I create long-lasting composite veneers that will be aesthetics. And I will try to simplify the work for you because it's all about, at the end of the day, to create simple environment, enjoyable environment, that it will be easy for you to create those veneers. You'll see all the tips and tricks, and let's start. So I'm just gonna, okay. So composite veneers, as you all know, it's a very challenging procedure. It's actually one of the most challenging procedure in aesthetic dentistry because it's involved a lot of steps, and including an artistic challenge that we are not artists. We're all very good dentists, very good engineers, but we're not lab technicians. It's very hard for us to create the shape, the anatomy, the line angles. So a lot of dentists, unfortunately, these days, they still recommend their patients to go for the more less invasive, a more invasive way, which is porcelain veneers. And why we need to do more composite veneers? What is the reason that I recommend to go and do more composite work? I don't know, it doesn't work. Second. In an ADA survey in 2015, they found in 7 different states with various income levels that 1 in 4 patients avoid smiling due to the condition of their mouth and teeth. That means that 25% of your patients, and I can see it in my practice as well, when they come to here, a lot of them, they will avoid showing their teeth when they smile, they'll put their hands when they smile, and these are potentially your patients that they come to your clinic, and potentially they can increase your income and you can make them happy. A lot of dentists, they will avoid telling the patient that come to the clinic that they need the work because they don't want to embarrass the patient if they don't come up with the question. And I'll show you in my clinic how do we approach patients that don't come up with a problem. They come to your clinic for something else, and you can see their aesthetic problem, and actually come to them and tell them, look, you have a problem, we want to fix it. The way I'll do it in my clinic is that we have a form, and on this form that they, the health form that they have in the clinic, there is a question there, and the question asks, are you happy with your smile? And they tick yes or no. And if they say no, we know that we can ask them about why did you tick, you're not happy with your smile, what's the problem? And then they will start talking about the problem. 59% of your patients that don't fix their smile, they will, according to this survey, it's because of the cost. It will be expensive for them. Probably other options, they were told them that it has to be an orthodontic treatment, it has to be a porcelain veneer treatment, and composite veneers, they will be always surprised that it's an option and it's not an expensive option. So what is the benefit of doing composite veneer in your clinic? It's a very minimal invasive procedure compared to the other procedures that we do in aesthetic dentistry, and it's a phased option. It's a transitional option. They can always do porcelain veneers down the track. Survival rate, according to studies, is 89% after 5 years, and 86% after 10 years. And it's quite a big survival rate of those veneers. Yes, they will have some surface changes. They will maybe stain a little bit and chip, but those are very easy to fix. They're very affordable. Usually we charge half of the price of porcelain veneers or 1/3 of the price. And there is a high acceptance rate as a result. It will definitely will increase the income of your practice because there is more acceptance rates to do the composite work. You will attend 1 tooth, half a tooth, 2 teeth. You don't have to do 10 teeth. and this will increase your referrals. Also, there is very minimal contraindication to do composite veneers, whereas porcelain veneer have more contraindication, and also composite, they will wear off well down when your patient grind their teeth. So you are more safe to do composite compared to porcelain if, let's say, there is a malocclusion, or the bite is edge to edge, or the patient grind his teeth. You can do single tooth, and you can do mini smile enhancement as a result. So this is cases that I've done. All the cases in this lecture are cases that we've done in the clinic here. The first case, we done only one tooth. We, of course, bleach the teeth before. We always bleach the teeth before we do any aesthetic work, even composites. And then we ask the patient to wait 2 weeks after the bleaching because the oxygen can interfere with the bonding. So 2 weeks after the bleaching, they will start, they come back and we do the bonding. And in this case, for example, we did only one tooth, number 1, 2, and we fixed the 2, 1 just on the edge, all done with composite. In the second case, it's only 2 teeth, and then the incisal edge was fixed with flowable composite. In the last case, it's only 2 teeth and, of course, bleaching. So as you can see, those patients didn't spend a lot of money. They came from other practices that they were keep told that they have to do 6 to 10 porcelain veneers, and we made them happy. And a lot of patients, they will be happy even if you do 1 or 2 teeth. They don't want to go and do the whole porcelain work. They will be very happy if you fix 1 or 2 teeth. What is the contraindication of porcelain veneer compared to composite veneer? Porcelain veneer, the contraindication are much more than composite. If patient have a high caries susceptibility, I will stay away from doing porcelain, sorry. If it's a young age, for me, if it's like under 21, I will stay away from doing porcelain work. Of course, malocclusion, they can delaminate, they can break the porcelain veneers. You cannot do single tooth scans unless you have the brilliant lab. And also if you have a good lab and they will imitate 1 tooth with a veneer, porcelain veneer, in few years, the teeth will stay and the porcelain will stay white or the other color that you chose, and it will stand out. Of course, financials and periodontal disease. You don't want to start big and expensive work on someone that their teeth is mobile or they have any not long-term time with their teeth in the mouth. With composite veneer, if you have not sufficient enamel, you will not do this. This is a contraindication. You need enough enamel because we rely on bonding. With porcelain veneer, you can wrap it. You can do 3/4 crown. With composite veneer, no, you do rely on enamel. So if someone has let's say if it's a girl and it's bulimic and they have erosion of the teeth, the enamel, I will maybe stay away from doing composite veneers. And also if the patient have a high expectations, very high expectation, patients come to me and they say, Sigal, I want to have a Hollywood white smile with long teeth. I will stay away from doing composite because composite, they look more natural. They're not meant for 10 or 20 teeth. They can chip in the future, and it's better to go with something stronger, like porcelain. Periodontal issues. This is a sample example of a girl that she came to us. Yes, she does the periodontic. She go to the periodontist, and she couldn't do braces because the teeth were too mobile. And we did 6 composite veneers as a solution for her. Now the question is, this was why we need to do composite veneer. Now, how do we do composite veneers? And in the next session, I will talk to you about some tips and tricks. Before I do any procedure, if it's a porcelain veneer or if it's a composite veneer, I will always do 2 things. I will bleach the teeth and I will do gum contouring. I'm always looking at the pink aesthetic as well, because if I finish when the gums look on the left or on the right, if I finish my work, it will still not look ideal. I use the laser for gum contouring. And in severe cases, when I need to extend the bone as well, I'll send to the periodontist. I will always start with the laser, and then I wait 21 days for healing. With the bleaching, I used for many years in my clinic. We use the opalescence go by Ultradent. I don't take any impressions. I don't bother with the trays because everything including in this package. It's also very affordable, so it's easy for me to convince my patients to do bleaching. And why do I bleach the teeth before I do any composite work or even porcelain? From two reasons. One of the reasons is I want a good background. I want a good foundation for my composite. Because the composite is a material that reflects, it will reflect the color of the underlying tooth. So I would like to have a whiter background. I would also like to whiten the opposing teeth so we can go whiter on our work with the composite. So the way you use this opalescence go, I'll show you a short video how to use this. This is a package that the gel is included inside its upper and lower jaw. They just insert it into the mouth. They will kind of do a suction. And then they will remove the green delivery system there. And then they will have this tray with the gel, and they leave it. It's a hydrogen peroxide. I usually sell the 10%. It comes in 6, 10, and 15%. And you can, they just leave it for 30 to 1 hour in the mouth. So it's not you don't have to leave it during the night. Very easy and affordable. Now, long-term success of composite veneers. There is a lot of steps that are included in that. It's about good case selection, like everything in dentistry. It's about composite shade selection, the right shade selection. And this is something that they don't teach us in school. We rely on companies that will come with a composite to our clinic. And I will show you in the next slides how in many cases, I can nail the shade. I have a system that I do it, and I'll show you how. Of course, the correct tooth preparation, bonding and curing is very important, creating the anatomical shape, polishing, and the final occlusion tuning. All of these factors, they contribute to your success and the long-term success of your composites. I have only 1 hour, so I will not speak about all of these factors, but I will mention some tips on each one of them. I will start with selecting the right composite shade. And how do we do it? So the first thing, you have to understand that there are parameters that affect the final shade. It is the brand of the composite. Every brand has a different value. Value is the grayness and the whiteness of the composite, or the translucency of the composite. It could be A1 from one company and then A1 from the other company. It will look completely different. So the brand of the composite is important. It's also the reflection of the underlying teeth will affect the final color. How much thickness of composite you apply, how many layers. The light curing can change the shade as well, and the final polishing will change the shade. If you understand that all of these factors will affect the final shade, then you understand that it's not enough to have one composite, let's say A1, and say this will cover all of my cases. No, it's not the right thing. So the first thing is, let's make it simple. Avoid those complicated layering techniques. The composite, the new generation composite, they are more chameleon. You apply it on the tooth and it kind of attracts the color of the tooth. It's not like in the past. So you can work with less layers, and companies, they understand that, and they give us now maybe 1 or 2 layers, not too many like in the past. And then I don't really buy the whole range of 20 colors. No, I have, those is the basic color that I have in my tool. A1, A2, A3, A3.5. B1 is a very good color. Bleach white and translucent. Now I don't have one from each, because if you buy from, as I said, from one brand, you will get one value, one translucency. So for example, have a look at this on the right. This is some of my composite. A1, all of them A1. If you look at the colors, they're completely different. Some of them are more gray, some of them are more opaque, some of them are more translucent. So I have A1 from different brands. And this is important to understand. If you see on the left side, the A1 and A1, has a low value, one is a high value. High value means more opaque, low value is more translucent. That's just different brands. Also, you can create accurate shade guide from your composites, because the Vita shade guide that you're using today is made for porcelain. It's not really made for your composite. It's not even a composite material. So you can rely on it just at the beginning as a general shade, but when you want to be accurate, it's better to use your own composite shade. And many brands, they come with their own shade that is based on their composites. But the most important tip I want to give you today about the shade is I do a direct shade trial. It's a mock-up. So I apply the composite directly on the tooth that I want to work, not on the tooth next to it, directly on the tooth I want to work. And the way I do it, I don't dry the tooth, because if I will dry the tooth, it will be too white. It will get a different shade. So it's I'll leave it natural or wet it a little bit. I apply directly on the tooth that I want to work with, that I said, and I aim for the same thickness as the final restoration, because thickness changes the shade. If it's very thin, it will attract more color of the tooth. If it will be very more thick, it will mask more. I always cure when I do that, because curing can change the shade a little bit. And then after that, I will flip it out and I will try another shade. And like this, I spend sometimes 5 to 10 minutes until I nail the shade. It has to be the accurate shade. Sometimes I ask my nurse or the patient, this is where we want to go. And then this is how I do it. A lot of dentists, they just do those bulk of composite on the teeth. I don't really like it. I don't think it will give you the whole picture on different areas of the tooth. So the right side, this is how I really do it. You can do it with your hands. You can do it with the Uveneer. I'll show you later how to work with a kit. But this is a must. We do a mock-up. It's not that expensive. Dentists think that they will waste composite. It is only a few cents, and it will save you a lot of problem in the future. How do we prepare a tooth for a direct composites? So first of all, composites is an additive dentistry. So sometimes I don't even prep the teeth. You don't really need to do any chamfer or shoulder. You can finish knife edge. Stay on enamel, of course, if you can. And there is no incisal cutting. Do not cut anything from the incisal area. This is not porcelain. You do not wrap the composite. Composite actually love to rely on enamel. They will be stronger. And there is interproximal reduction is not necessary. We don't need to do that. Stay above the gums when you prep, of course, and you can finish with a feather edge or light chamfer. Buccal reduction depends on how much you wish to achieve. What do you want to achieve? If you want to mask the tooth, if the tooth is too gray or yellow and you want to make it whiter, you will prepare more because you want thicker composite. If you just want to stay with the same shade of the tooth and you just want to change morphology, then I don't even cut the tooth at all. Let's talk about the final contour and the anatomical shaping. It's very challenging. It's very hard to do the three fashional plane, the line angles, the lobes, the groove. We are not lab technician. And we also, the position of the patient is very difficult for us. We cannot take one tooth out and work outside like the lab technician. So this creates a lot of problem. And this was my problem back then. I loved composite, but I found it very hard. It was not predictable. Every time I finished, it finished in a different shape. And I looked for predictability because I think that in aesthetic dentistry, predictability is a very important thing. You need to know where you're heading. So in 2014, after looking for other options in the market, I couldn't find, I invented the Uveneer. And what is the Uveneer? The Uveneer is a template system made out of fiberglass. It's autoclavable. You can reuse it a lot of times. And this basically templates that mimic the shape of a veneer. I want to show you how it works. So it's the upper and lower teeth. You have two sizes. So first, of course, you remove the caries. You always rough the tooth with a diamond burr or sandblast, and you will apply separation on the teeth, between the teeth, so patient can, of course, floss afterwards. Etching for 20 seconds, and bond according to the instruction of the manufacturer. I like to apply 2 layers and then only dry and cure. You cure for 10 seconds, or according again to your manufacturing curing light instructions. Apply any composite you want on the tooth, of course, the composite that will match the shade, because you did the mock-up before, and you apply the Uveneer, the right Uveneer. So we have numbers on those, the numbers they're on the template, on the handle. You press hard. As you're pressing hard, you're breaking the internal bubbles and you block the oxygen inhibition layer. There is also a center line on the outside of the template, so you know how to position it parallel with the middle of the face. Then you remove the excess. You can also remove the excess before you cure. There is 2 sizes, and large and medium, from premolar to premolar, upper and lower teeth. Last year we came with a new kit. It's called the Uveneer Extra. Has more sizes. We have extra large sizes, a little bit more unusual sizes that if we need to complement this kit. I will talk about the Uveneer Extra later. There is other changes there, additional changes. But the basic kit has upper and lower teeth as well, so mandibular teeth as well. And this pretty much will cover 90% of your patient. And I will show you later cases how I work with templates that don't really fit the size, but how I can make it fit to the tooth. So the template size are according to the smile design rules. That means according to the ideal smile design, when we're looking about beautiful teeth, the size of the central should be anything from 10.4 to 11.2 millimeter, 80% width to length. And this is how we have the kit is based on that. So the central incisor, the medium are 10.2 millimeter, and the large one are 11.4 millimeter. So this will cover most of the ideal sizes of teeth in the population. And of course, from then on, the lateral, they should be 1 millimeter shorter. The canine and the central are the same size. So we based the kit on according to these smile design rules. Of course, if you want to change, you want to round some corners, you can always take your burrs and do the changes. Each one of them is autoclavable. It has a non-stick surface, so you don't have to actually put any glycerin or anything, so the composite will not stick. It will not stick to the composite. Actually, it will come up very easily. It's a very durable fiberglass material. If you lose one, you can purchase single one. And as I said, it is based on a smile design. What is the benefit to have such a kit in the clinic? It makes you work more efficient and faster. It's a one-time investment. You can use them many years at the clinic and move them from room to room. You can use any composite. And also the restoration will be stronger because there is no internal bubbles and you block the oxygen inhibition layer. And what is the oxygen inhibition layer and why it's important? When we cure composite, the monomers become polymers, but the oxygen in the air or in the bleaching material can interfere the polymerization. And some monomers, they will not become polymers. They will be like not cured. So that's why when they suggest as the manufacturer after we cure composite to apply glycerin and cure again. So we block the oxygen during the polymerization. When we press the Uveneer and we cure it, during the curing, there is no oxygen. So that's why you're getting a very glossy surface. So many times I don't even have to polish it. This is one of the best polish gloss in dentistry, the best polish in dentistry. Same like when you take cellulose strip and you press on composite and you cure. So it will be very shiny. And also they found that this oxygen inhibition layer, this layer that is not fully cured, it's softer and it will susceptible to wear and discoloration. So it's really important to block the oxygen inhibition layer if you don't want future staining. What can you use the Uveneer for? You can use it for direct veneers, class 4, class 5 diastema closure. Mock-up, you can do mock-up for the patient, show him how it looks. You can do them direct or indirect on the model. You can use them as a provisionals for your porcelain veneers, and you can use them as a guide for your gum lift. And I'll show you cases. Let's talk about some cases. So as I said, before any case, the pre-veneer preparation will be do the bleaching and doing the gum contouring. And this is a case of a reverse smile. So usually the upper teeth, the ideal thing is that the upper teeth will follow the lower teeth, the curve of the lower lip. In this case, it's a reverse smile. As you can see, the incisors, the central incisor, they are intruded. This is the easiest case because we don't have to grind the teeth at all. We try, is this the medium or the large? So we want to cover, how do we decide the size? We would like to cover the mesial and the distal of the tooth and the gum level. The length is less important because the length, of course, as you see, it was worn down. So always rough the tooth. You don't have to cut back, just rough it with diamond burr, sandblast it. If you have sandblast, it's amazing. It will increase the bonding as well. And you apply the etching, 15 to 20 seconds. If dentin is exposed, then do less than 15 seconds, please. The bonding, come afterwards, scrub for 10 seconds, dry, let the ethanol, the acetone to evaporate. And when the surface appears glossy, then I cure it. Before you cure, you can remove the excess and then cure. And this is when it was finished. You can see she shows the teeth more on a relaxed position, and that's the ideal. And that's a video of how I did it and I did only 4 teeth. We bleached it before. As you can see, there were gaps. The teeth were discolored, and I'm going to show you how I did 4 composite veneer. This took me about 1.5 hours or even less, I think. And so first of all, you etch the tooth, you bond it, you put separation between the teeth, and the Uveneer is pressed with a little bit of flowable inside the template to get the gloss from the flow. I use Genial Flow by GC. So there is a packable composite on the tooth, and inside the template, I apply a little bit of the Genial Flow, or you can use any high fill flow that you have. Again, bonding, composite is applied on the tooth, freehand, don't have to spread it on everywhere. It will, when you press, it will get to the gums and everywhere there. So you press it, clean the excess. Midline is parallel with the middle of the face. Cure it, and then remove the template. I work with extra fine diamond burrs on the periphery, soft flex on the incisal area, and then buffer. A buffer is with polishing diamond paste. It's like a cotton discs, and it makes it very shiny. All right, let's continue. So why did I put flowable inside the template and packable on the tooth? Because I get the strength from the composite, the nano hybrid, the packable composite. This is where I get the strength, and I get the beauty and the aesthetic from the high fill flow. It has to be high fill flow with a high filler flowable. and you apply it inside the template, not too much. And it also gives me the enamel shade. You know, you have the dentin shade. Usually the flowable, they will be low value. They will be more translucent, more enamel-like. I don't really like to use the enamel shade composites because the enamel shade composite, they tend to be more gray, and you have to use them in a very thin amount not to affect the final color of the composite. So I prefer to use a very thin amount of flowable inside the template. And then I combine them together and I cure it. How do I deal with the periphery? I use an extra fine diamond burst, a polishing disc, of course, and the interproximal saw. This is where I make sure that on the contact I open, and after this, I'm going to use the interproximal polishing strips. In between the teeth, Teflon tape is great, a mylar strip, and if the teeth are very, very tight and you cannot insert anything so flimsy, yes, then I can even cut the metal matrices and I just pull it backwards toward the palate. I like to do mock-ups. I like to do them with the Uveneer, without the Uveneer, a mock-up to show the patient how it will look. And this is a great motivational, it's a marketing tool. And it also shows me if I like the shade, it shows me where I'm heading. It shows me the reaction of the patient, if the patient is happy, if the expectation is achieved with the mock-up, or they have high expectation maybe. So I learn a lot of things from just doing the patient mock-ups. With the mock-up, you do not etch the tooth, you don't bond the tooth, you apply it directly on the tooth and you press the Uveneer and cure it. You can then flip it out, and in your hands, you can work on the periphery, apply some glycerin or Vaseline and put it back on the tooth. Many times the patient, they take their phone and they click and they do before and after. And this is really great. And I do it quite a lot. As to convince the patient that it can do good. It's a predictable dentistry, and it's also it's a great communication tool with the laboratory as well, with the lab technician. If I want to do some porcelain veneers, I can do those mock-up and send them the size that we agreed with the patient. I want to show you a case that the template didn't fit perfectly, but I still liked it because I like the shape of the Uveneer, and this is done with the Uveneer extra. So that case, the patient came up with the enamel hypoplasia. He was 18 years old. When he was 2.5 years by age, he lost his 4 front teeth, had an avulsion. He fell and he lost them. If it happens before the age of 3, enamel hypoplasia can happen in many, many cases. After the age of 3, when the teeth are more formed, the chances are better. When it's before the age of 3 and the teeth are completely evolved, it could damage the enamel of the permanent teeth, and that's what happened to him. I prepared the teeth, I roughed it, and then I sandblasted it. You apply the composite on the tooth, and here I pressed a template that wasn't the same size, but I really like this shape for him. Not a problem. I take my burr and I just go on the surface and remove the excess on the periphery. And actually I finish it like that. So you can see that you can use a smaller template and just adjust it to the right, to the tooth. And this is after. You can also use a Uveneer as a temporary measurement, as a provisional. In this case, it was done for implants. You can put the abutment, the temporary abutment if it's an immediate implant, and some composite around it, and Uveneer, and that's your temporary, and it's held really well, and it looks beautiful. It also can hold the gum on the shape of the gum, the round curve with the composite. I do a lot of laser gum correction in my clinic. As I told you, the pink aesthetic is very important because it finishes the whole work much more seamlessly, it's finished it more aesthetically when we look at the pink aesthetic as well. So I use the laser. In this case, for example, as you can see, her gum level is not equal. It's not like it's supposed to be. It's not the ideal gum. And what is the ideal position of the gum level? The central and the canine usually has to be the same height. Canine can be a little bit higher. And the lateral should be about 1 millimeter shorter. They're not the same height. In this case, I had to increase the number 1, 2, the height of the gums, and use the Uveneer. I press the Uveneer into the gum tissue, and then there is a demarcation of a line when I do that. I mark the line with the probe, and I follow it with the laser, those bleeding spots. As you can see, I used the Gemini by Ultraden. It's a really nice laser, very efficient and strong. I recommend you to have, if you do aesthetic work, to have a good laser, soft tissue laser in your clinic. If you don't have, you can use scalpel or you can coagulate it if you have the machine. You press the Uveneer, you have to wait 21 days again for healing. And this is the before and this is the after. Okay. If patients break their denture, in many cases we have all-on-4, and all-on-4 on opposing permanent teeth, for example, can fracture. In order for us to fix that, we have to remove the implants. It's quite a hassle. Send it to the lab, and the lab add the teeth. What I found that I'm doing it for many, many years now, I bond composite to acrylic teeth. The bond strength is quite high. The way I do it, I rough the area. I will rough the acrylic with a coarse diamond burr. If you have sandblast, it's amazing as well. It's always increased the bond strength. I apply universal bonding agent, and then I cure, apply composite, Uveneer, and cure. You will be surprised how much time the composite will stay in the acrylic. I have cases that have done for many years, it's still there. Now, you have nothing to lose. It's either try it or send it to the lab now. I will ask you if you trust me, try to do it, it will work. Composite can bond to acrylic, and even if it's an emergency, it's a great solution. You can try to do it. And then of course the Uveneer pressed. Remove the excess and polish. A lot of dentists, they ask me, can I do the layering technique with the Uveneer? I love my dentine, I love my enamel shade. Yes, you can. And the way you do this, you apply the dentine onto the tooth, the dentine shade. You create those mamelons, the palatal, the translucent halo effect. You can apply low value flowable, so more translucent flowable inside the template, press them together, and you will get those halo effect, the more natural looking, like we like it. You can also use it as a splint. If somebody's missing a tooth and you're waiting for the implant, you apply the fiber splint, composite, Uveneer, and you have the temporary solution. How do I build the palatal surface of the tooth? Let's say in class 4, for example, or in diastema. There is few ways you can create a template, a silicone template, and you can rely on that. But that means you have to take an impression, send it to the lab, create the model, or you can use your fingers. And there is another invention called the Paladex. I came up with this about a year ago. And the Paladex basically give you the palatal, the index for the palatal side of the tooth. Has two sizes, like the Uveneer. At the moment, you can only purchase it from the website. And it creates, instead of creating those models, you can use those silicone templates. How do I mask the dark tooth? This is a question that I get a lot in my lectures because this is quite a challenge. That's a dark tooth, and now I'm going to show you how I do that. It's very hard to mask the dark tooth with one layer of composite. One layer of composite almost never will mask something that is darker. We need to do layers. And when I'm saying we need to build layers, I don't talk about dentin and enamel layers. I'm talking about layers from the same composite. For example, if we paint a wall, we will do a first layer and then second layer, we'll let it dry and then do the third layer from the same paint, same color. Same thing we do here. So when I removed the old composite, this is what I found. There was a bit of a decay and the tooth was extremely brown. Sandblast, clean the decay, of course, remove the decay and sandblast the area. I apply here the Paladex, some flowable composite inside, I remove it, and I apply the first layer of composite. Before that, I put some layer of flowable composite on the tooth. This is my first masking layer, second masking layer, and I pressed some flowable on top, so it's kind of like 3 layers. And oops, it was still not, I wasn't happy with the color. It was too low value, it was too gray, it was too translucent. I wasn't happy. So the way I treat that, don't get, no panic, you just cut back the tooth, you apply bond, and you apply another layer of the same composite. And this time I use less of the flowable into the template because the flow gave it like a dark, more low value. So I put another layer of composite onto the 3 layers that I already put, and I press the Uveneer again. So you see, in order to mask the dark tooth, I know you can put an opaque composite, opaquer. I don't, I use the same composite, but I do it in 3 layers. Same like we do a nail polish, we put 3 layers of nail polish in order to mask the color of the nail. And this one, this color, I really liked it. I thought it was good. And I started to polish it and make it look like the tooth, the adjacent tooth. I apply some demarcation lines, the perikamata we call them, to make it more natural and mimic the tooth, the tooth that was proximal to it. And this is when we finish. And from the side. So what I'm trying to say here, with composite, if you're not happy, if something happened and the color is not matching, if there is a bubble, if there is, you trapped a bubble, if there is something that the underlying tooth is reflecting, don't worry. You cut back, you apply some bond, and you do second layer. Sometimes patients come after 1 week and they say, look, the tooth is a bit gray. Don't worry, cut back and try to find the right color. Composite can bond to composite with no problem. The Uveneer extra kit. So after the Uveneer was in the market for a few years, a lot of dentists, they wanted more sizes. So we added 4 additional sizes and shape, only canine to canine, no premolar and no mandibular teeth. It's only maxillary teeth and additional sizes. Those are very natural with tertiary anatomy. And some perikamata even, because they were scanned from real patients' teeth based on Dr. Jan Heiter models. Dr. Jan Heiter is a German dentist from Munich, and he created 48 models that he scanned from real patients, the ideal teeth. We used 4 of his teeth, of course, with his permission, and we created an additional sizes. We have the sizes that we have in the kit are extra large, large, medium, and square, for square looking teeth. As you can see, they have a very high the texture. They're full of texture, very natural. I have to tell you that a lot of dentists, this is one case that we did with the Uveneer Extra, the large size, and you can see the tertiary anatomy very pronounced in this with these templates. I have to tell you that some patients, they don't really like that it's too much anatomy. They like it more flat, Hollywood. But you can always flat it if you wish. We, the dentists, we love this artistry. And so it's up to you. You have now more options. If you have the Uveneer Extra and the Uveneer Basic, you have all the options. And this is the case that I've done with the Uveneer Extra. So of course, the laser, the Gemini laser is 21 days you wait for healing. I use the aqua care and sandblast, etching, bonding. Okay. One of the things that I really want to emphasize is that the curing light. The curing light is one of the most important tool in my practice. I use it all the time. I rely on it for my future work to last long. If you don't have the right curing light, you can create sensitivities. Your work with fracture, it will wear down, because if you don't cure it completely, when they brush their teeth during the veneer will wear down. So I believe that investing in a good curing light is a must. I used the Velo by Ultradent for many years. It never disappointed me. I highly recommend you not to buy lights from eBay, or if they think that they cure. You actually, it's a boomerang. It will come back to you. And yeah, so this is my recommendation. Not to use any light, just invest in a good light. Sorry, this case, we've seen it. We just go past it. And if you have questions that I didn't answer during this lecture, I would love to answer. It's very important to understand how to minimize composite future staining. And why do we get staining at all? I hardly get any staining in my work. I have work that they come back after 7 years, 8 years, and the color doesn't change. It's and why? First of all, if you use low fill flowable, not a high fill, or if you apply bonding on the outer layer of your composite, a lot of dentists, they take the bond and they just want to shine the surface. This will stain. Any coffee, tea, red wine will stain your composites. If you're not using the right curing light, or you're not curing for the enough time, it will stain. So try to cure more. There is never over curing. There is under curing. If you don't block the oxygen inhibition layer, even it with a Uveneer, or if it with just glycerin, it can stain. If you have any bleeding, during the work that you do on the gums, I will leave that tooth. I will then move to the other tooth and let the bleeding stop before you continue, because bleeding will create staining. You can use, I don't use any retraction cord, because retraction cord, when I remove the retraction cord, I will start bleeding. And also, I don't want to finish my composite under the gums. I want to finish them at the gum level. So why would I want to push the gum with it? So, but if you still have any bleeding or a lot of cervicular fluid, then you use the Viscostat Clear by Ultradent. It doesn't have ferrous in it, so ferrous so it doesn't stain. Using ferric sulfate using ferric as a homeostatic agent can stain. So ferric sulfate as a hemostatic agent can stain, and I use the aluminium sulfate, the viscostat clear. But try first to avoid the tooth, let the bleeding stop, and then when it stops, you can press it. I use sometimes wedges, wooden wedges to stop the bleeding, and then I can finish my work. Insufficient polish is the main thing that stains the teeth. I work very highly on my polish. I spend a lot of time on my polish. I use all the steps, all the discs from the Soflex disc from 3M I use. And then I use a diamond paste with Ultraden has a beautiful diamond paste. And then I finish it with the goat and cotton hair polishing. If you don't find it, the goat cotton hair polishing, you can ask it from your lab technician. They all have it. And you can finish it. And they found with studies that if you finish and polish with those diamond paste and the goat hair cotton polishing, you will reduce staining. What do you recommend to do after? First of all, when I finish my work, I try to avoid any premature contact from the opposing teeth in any position. You try the anterior guidance, right, left. See that there is no one tooth hitting your composite. Try to do it balanced occlusion, that many teeth will touch at the same time. Then I tell the patient not to eat or drink any food with stain for the next 24 hours. And of course, not to use your teeth as a tool. Hopefully they don't bite their nails. This is a big no-no. And I always call them for a touch-up appointment after 1 or 2 weeks. And why? Because in this 1 or 2 weeks, this is the time that if they will be cheap, it will happen. And then when they come back, first of all, they relax. They know they have another appointment. They're not upset on you that, oh, it broke and I just did the work. They have an appointment, you warn them, and then you are fixing it, the problem, and you find why did it happen. Try to move the teeth right and left. See which tooth from the opposing arch actually caused this little fracture, and then just balance the opposing tooth that causing the problem. And the price that you can charge, as I said, it's 1/3 to 1/2 of your porcelain work. I want to thank you, and I'm ready for the question and answers. Uveneer you can buy from any Ultraden dealer. Paladex you can order directly from me. And if you have any questions, you can also email me. I would love to answer you. Thank you.
Okay, thank you, Dr. Sigal, for the presentation. So now we're going to answer some of the questions that have been asked here. So first questions from Dr. Yuan Truong. So she asked about the diastema. So can we use Uveneer to diastema closure? I think you.
So with the diastema closure, it depends. If it's a big diastema closure, and you want to also veneer the tooth, yes, you can, of course. But in many cases, if it's a small diastema, you don't want to veneer the whole tooth. You just want to close the diastema. You want to look very natural. So what I do with my diastema, my small diastema, I do not use the Uveneer because I don't want to veneer the front of the tooth. I take, it's called IPC, interproximal carver. It's a very thin carver. I apply it in a wetting resin. Wetting resin is unfilled resin. I don't wet my instrument in a bond. I will wet it with wetting resin, and I will take the packable piece of the packable composite, and I'll wet it, and I'll make it kind of between flowable and between packable, and I'll start building it with my hands and closing the diastema together with the interproximal carver. I will use the Uveneer when I finish one diastema and I want to do the other tooth the same size. I use the Uveneer as a ruler, to measure, as a measurement that it will be the same size, because the Uveneer actually, they are a mirror image of each other. So you get the same size of centrals and laterals. So this is where I use the Uveneer to close the diastema.
Okay, so I think this is a question as well about diastema. So this is from Dr. Fikas Malik. How can we maintain mesial-diastole ratio in midline diastema case?
So this is how I said I use the Uveneer. First of all, you use your eyes, of course, and then you use the Uveneer every time you think you finish. You apply the Uveneer and you see the mesial-distal if you cover it, and then you move to the other tooth and you see if they are the same. If not, just take your burr and cut it to the right to fit the right size of the Uveneer. And also you can use the Paladex as well. They are both are the same.
Okay, thank you. Next question. This is from Dr. Arifur Rahman. So, what about the flowable composite while using Uveneer? And then the second question is there any risk of void formation while using Uveneer? If yes, what we should do to avoid?
Oh, that's a very good question. The Uveneer, as I said, I apply flowable composite, very small amount inside the template and the packable on the tooth. Yes, if I apply so first of all, it has to be high fill. High fill flowable, these are the flowable that accompanies the new generation. They are flowable with a high filler so that you can use them for class 1, class 2, and also on the outer surface. It will stain less because of the high amount of filler. So when I apply, but on the other hand, it has a beautiful gloss to it. And with the Uveneer Extra, it's actually capturing the whole details of the Uveneer Extra because it has a very high amount of texture in it. So when I press the Uveneer, if I will move the template too much, I can trap bubbles. But I'm not worried because these are external bubbles. They're not internal bubbles because I press the internal bubbles. And if I will have bubbles, that will be between the template and the flowable. And I don't, if I see bubbles, I press a little bit harder the template and I cure it. Then I remove it and I can see the bubble now. I rough it with my diamond burr again, and then I do another layer. Many times, in many cases that you've seen, I do 2 or 3 layers of the same composite, not because of bubbles, but sometimes I press too hard and I want to add another layer. But it's not a problem. You can do 10 layers if you want with the Uveneer.
Okay, next question. So are Uveneer available for molars for full mouth reconstruction after jaw repositioning with the correct vertical dimension?
The Uveneer it's not meant for big rehabilitation. You can definitely use them for temporaries for big rehabilitation. It will not open the bite because it's only external. It does not give you any occlusion. It doesn't have the molar, just the premolar, second premolar as well. But it will determine the ideal size of the centrals, which many cases when I open the bite for patients, I will start from the front teeth. I will determine the height of the front teeth, and then I will go back and build my back teeth. But they're not meant to open the bite because they're only on the buccal side.
Okay, thank you. For next question from Dr. Jasprit Kaur. What about if patient has short teeth and they want to increase the length and we use Uveneer for good shape and good size, would not it will interfere the bite?
Okay, so if it's edge to edge, you cannot build it because the opposing teeth, they just hit like that. But if it's in a class 1, you can definitely increase the height of to the ideal size. Make sure that the lower teeth are in balance occlusion. So when they grind it, they put their teeth forward, there is not one tooth that hits the veneer. And I can tell you that it works in many cases, but you have to warn the patient that because there is no support of a tooth, then it might chip in these areas. And then later down the track, they go and do porcelain. But if it, let's say they break and the patient is heavily grinding and you added the teeth, and it's not only Uveneer, it's any composite veneer, and they start breaking the incisal area, then you just go back to the height that it was. It's not a big deal because you didn't cut the tooth on purpose. You actually go back to how it was and you correct the bite. Maybe you do an orthodontic treatment, and then you can do porcelain veneers. But I increased the height many times, and I don't see a lot of problems with the new generation composite. Honestly, the new generation composite, they are much stronger. The physical properties, the aesthetic properties, they're amazing compared to what we used to have. So I trust them.
Okay, so next question from Dr. Gunawan. In case we made a mistake in the process, do we have to redo all over again? Do we have to remove all the composite, or any tips or tricks on it? And you know, for him, that sometimes it's hard to distinguish composite from the tooth, especially when the color is so similar. And yeah, and then what makes total composite removal so challenging? So, is any tips and tricks on how to, if we make a mistake,
Can
and
you
then
just repeat the first sentence? If what?
if we do we have to redo all over again if we made a mistake during the process? Do we have to remove all the composite?
Okay, I will go even further with this question. If a patient come to you with an old composite and you want to do new composite on top, do I have to remove all of it? If I do a new composite and I'm not happy with the result, do I have to remove all of it? No, I don't. Composite bond to composite. So I just remove the a little bit, maybe half a millimeter, and I apply bond or wetting resin, and then I apply second layer with a Uveneer. So there is no problem. You can fix as many times the color, the shade with a new layer. That's it.
So another question from Anonymous. After 5 years of direct composite veneers, if they turn to more yellow or like stains, how do we fix it? I think you mentioned during the presentation, but yeah, how do we fix?
No, you just fix it by polishing. So what I tell my patients, you need to come back every 6 months for maintaining. You don't just do the composite veneers and you just disappear. I need to see you. I need to see you at least every 6 months to 1 year. And this 1 year, I don't charge them, by the way, for this. They come for 10 minutes, 5 minutes. I look at the veneers, and if I need to polish them, I polish them. I give them warranty for the first 2 years.
Okay.
But this is, I charge a little bit more, and I explain them that this including the warranty for the next 2 years. And if you need to polish it, it's fine. It takes a few seconds, but you will be surprised how much minimal staining you will get if you follow the step that I told you before.
So every 6 months. Okay, next question. This is from Lee Tan Ping, Dr. Lee Tan Ping. Do you mix using different brand of composite when you're doing the veneer?
Yes. Yes, I use Genial. I have many companies, and I'll tell you even more. You can even change colors. You can take A1 and A2. This I do from the same brand, and you can mix them together to get 1.5 color, or A1 and B1 to get this different color. There is also something that's called tint. Tints, they are shade of, there are tints, they like brown and white, and you can create the fluorosis effect. You can create some more brown around the gums. The way I do it with my tinting, I take flowable composite, I use the Genial by GC, and I mix it with a tint. And then I apply it with a brush where I need it. So I just don't just take the tint and put it because it will wear off. I will mix it with the high field flow, and I'll start to paint the tooth if I need.
Okay, cool. So when you just now you mentioned about fluorosis, so this one question from Anonymous, she asked about how do we treat teeth with fluorosis? So is it this contraindicated? So yeah, what do you think about this?
No, it's not contraindicated. Teeth with fluorosis, you can try to use all there is product that remove the fluorosis, but it's very severe. Then you will apply composite on top. You will need to remove a little bit of the thickness of the tooth in order to get a nice thickness of composite, not too much though. Always stay on enamel and then build your composite with I will start very, very thin layer without the Uveneer and then polish it.
Okay, so next question from Dr. Akbar Mahmood. Just now during the presentation, you showed the laser surgery. So he asked about how many days that we have to wait after the laser surgery.
21 days.
21 days. Okay. So next question.
Oh, and some dentists, they like to put composite, so the gum will stay on the same level. I don't think it's good. It can create a problem. It can create because sometimes the gums, the bone is too close to where you cut it, and the gums, they want to grow back. And if you stop it with composite, you may cause inflammation. Let it stay 21 days without anything and see. Many cases, they just stay the same way you left them.
The next question, this is from Dr. Shanu. What if patient bites on a solid food? Will that affect the strength of the composite veneer? Sorry.
It shouldn't. They can bite into. Look, you tell them be careful. Of course, don't use your tooth as a tool, but they should be very strong. If there is enamel supporting and the teeth are not extended, I never had a problem of just biting, bread or sandwich and this comes off. No, I do recommend and I do that when I increase the height of many teeth to use a mouth guard. So to create a mouth guard to protect your work.
Okay. So next question, this is from Dr. Tanya Sultana. Is in every cases, do we need to sandblasting?
Yes, but if you don't have it, still okay with the burr. But sandblast, if you have the sandblast, it's really amazing. I use it for every case.
So next question from Rochelle, Dr. Rochelle. She asks, how do we have a clean and smooth margins after restoration?
Okay, so first there is steps that I do. Extra fine diamond burrs, flame shaped, for the periphery. And the most important thing, I use my magnification glasses. I use 4.5 magnification glasses. Minimum, I think, is 3, because you really need to see what you do on those areas next to the gums. Then I finish with the periphery. I take Soflex disc or whatever disc you use for, and then I work on the incisal areas. I take my interproximal saw. I open between the proximal areas because sometimes the flowable composite can stuck there. And then I take the interproximal polishing strips and I work around these areas again. I run a floss to see that the floss doesn't attach, doesn't stuck somewhere there. And that's it pretty much. And then with the polishing, diamond polishing paste and the cotton discs, the goat hair disc, and then we finished. Yeah.
So next question, this is from Dr. Akbar Mahmood. How do we reduce the post-operative hypersensitivity if needed?
First of all, you don't cut too much of the tooth, so you shouldn't have any sensitivity. On the contrary, this is an additive dentistry, so you add protection of composite to the sensitivity if there is sensitive teeth. And I will not etch more than 20 seconds. I will not leave the etch too long. Use bond, composite layer. No, usually there's no sensitivity. Shouldn't be any sensitivity. Unless you cut too much into dentin, of course, then you shouldn't.
Okay. The next question, this is from Dr. Adila Sultana Liza. Can I use to veneer in 1/3 fractured anterior teeth?
Can you use what?
Use to veneer in 1/3 fractured anterior teeth.
100%. This is the best cases. They come to your emergency. You are with other patients and they're waiting in the waiting room. They come to your clinic, they fracture, the child just fracture 1/3 of the tooth. Hopefully there is no pulp exposure, and then you apply the composite. If you have Paladex, you can start with the Paladex. If not, just use your fingers. You press the Uveneer with the composite, and with your finger, you tuck it at the back. And in I'm telling you, 20 minutes, they can leave the room.
So next question, this is from Dr. Matt Ashraful Berry. What should be the ideal thickness of the composite to be cured properly? And what should be the ideal distance of curing light from the filling surface?
Okay, so that depends also on the light, what light you have, but the Velo is quite very strong light. The thickness is usually 2 millimeter, as you know, for if in class 1. But and the distance, I really touch my Velo. I'm almost touching the Uveneer. Just be careful from the heating. So I use the regular setting. I don't use the high setting if I'm very close. And that's it. And by the way, if you are using a very high, powerful, strong, and heating the tooth, you can start sensitivity. So when you cure, just use the regular setting, the whole 20 to 40 seconds. And no, I'm quite close to the template when I cure.
So yeah, so we have another 19 questions. So next question, we have a question from Dr. Karim. So how Uveneer help with the case of rotated tooth? So like shape
Okay, so if the
lateral
tooth
or
rotated,
rotated tooth.
you mean if the tooth is rotated, the lateral rotated? So you just, what you do, if it's rotating and it's bulging out to the buccal, then you take your burr and you cut a little bit the bulging part. On the area that is rotated, you fill it up with composite. You press the Uveneer on the right position and you can correct the rotation.
Okay. So next question, this is from Dr. Chu Hui Singh. Hi, can I ask for spacing between teeth? Patient opt for veneer. Do we prepare the teeth first before placing the veneer?
With the composite, you mean?
Yeah.
The porcelain.
You prepare the teeth first before placing the veneer. Okay. So maybe we can. So maybe Chu Hui Singh, you can rephrase this question, send it to us again. So next question from Dr. DPR Eliminati. What post-operative instructions to be given to the patient?
Okay, so I always tell them that to maintain the teeth, first of all, the next 24 hours, not to eat anything with colors. The main thing that will stain are black tea, wine, red wine, black coffee, and anything like curry dishes. 24 hours, stay away. I always tell them, don't use your teeth as a tool. Don't open things with the teeth. Stay away from that. I also tell them to come 2 weeks later for assessment. On this assessment, I also take after photos. By the way, about the photos, I want to tell you that many times, in most of my cases, I take my iPhone and I take before and I take after photos. I have an app that's called Layout. I think it's free. Let me see if it's called Layout. And then in this app that's called Layout, it's called Layout. It's free app. And you can apply the photos before and after. And you, at the same time, when they're on the chair, I message it to them and they have before and after. And then you can put it on your Instagram as well. If you go on my Instagram, Dr. Sigal Jacobson, you will see how I do it. There is a lot of before and after, and they done with the layout.
Okay, so
yeah.
Sorry. So we're going to answer 5 more questions. So other than that, all the question maybe you can forward to your email. So next question we have here. Let me see here. So from Dr. Pei Ying Lee, should we place mylar strip in between the teeth while using Uveneer for direct composite build-up?
Yes.
Yes. The answer is yes. And then the next question, this is from Dr. Ruman Chaudhry. The mesial enamel of first premolars is significantly thicker in females. So also males lateral are significantly larger. All premolars had a correlation between massive crown with animal thing. Okay, so the question is, it's been pretty difficult to maintain those thickness perfectly. How do you solve such problem? So this is about the thickness. It's pretty difficult to maintain the thickness. So how do we solve the problem with the thickness of the teeth?
In the premolar or everywhere?
I think he asked about the premolars, all premolars.
Well, you just cut back a little bit more and build it up with the Uveneer again, with composite veneers to get the same thickness as you were before. You know, the thickness of the composite veneer can be from 0.1 to at least 1 millimeter. So you determine it by pressing how much hard you press the Uveneer and how much composite you apply. So if you apply too much and it's too thick, then cut back and you can finish with polishing. If you didn't press too hard, if you press too hard and it's very thin, it's not too thick enough, you just add another layer.
Okay, next question from Dr. Nahid Parveen. Is it essential to bleach young patient? So if, for example, 12 to or 13 years old before composite veneer or any age range?
It depends. I do bleach young people. I think 12 is too early, but definitely 14, 15. I use the 6% opalescence gold. You can even, with this hydrogen peroxide, you can even bleach when they have the braces in before they remove the braces, because it's hydrogen peroxide. And you just, yeah, it says you can bleach them before you put, and then, but the thing is with the bleaching, you have to understand, if they bleach their teeth and I do the composite to the right shade, they need to maintain this bleach. So I recommend them to come once a year to buy one package. They're not expensive, and to maintain it so they don't have to do the whole session again, the 10 session, but they do once a month, every 2 months, they do one tray and then another tray. So spread it out during the year, just to maintain.
Okay, I think yeah, I think that's all for the Q&A session. So any question we can you can forward to your email, sigal@uveneer.com. So thank you again, Dr. Sigal. Thank you very much for your presentation. Thank you very much for all the answers. So next, to all of you guys, if you want to learn more about our products and looking for interesting articles, you can visit our blog. In fact, we just published an article about Uveneer Extra, clinical guide from Dr. Sigal herself. So please have a look. I am going to share this the address now. And then beside that, we do have a free online seminar platform called Education Made Accessible, where you can register and join for free. You can find a list of topics, a presentation from experts all over the world, and of course, a certificate will be provided upon completion of the seminar. And you can also follow our Instagram and Facebook account because we're going to run a contest where you can win awesome prizes. So keep your eyes on it. And also, before we wrap up, we would like to announce that we are planning to do a series of webinar sessions like what we did at the moment every month. So next webinar in August, we will invite another great speaker, Dr. Ana Cecilia. She's from Brazil, to talk about prevention and sensitivity control. This is a very interesting topic, and we will share more details soon. So we are happy to preparing all these scientific programs with series of webinars, all free for all of you guys. So, and last but not least, we will email your certificate for today's webinar in the next few days. So I guess that's all from us. Stay safe and see you next time. Thank you.
Thank you very much.